Good afternoon for staying over. It is my pleasure to welcome our next speaker, a very distinguished speaker with a lot of CV. She is Dr. Faridah binti Muhammad Zain. She is a family medicine specialist with IBLN certification in lifestyle medicine, scope certified in weight management, certified in smoking cessation. She obtained a doctorate in social studies in which she developed a tobacco prevention intervention for early adolescents. Her clinical practice focuses on cardiovascular and cancer screening and prevention, including non-surgical weight management, nicotine dependence, and lifestyle medicine. Her research focuses mainly on health prevention, nicotine addiction, and chronic diseases. She is also actively involved in CME and has been participating in multiple national and international conferences as a speaker in the recent years. She has significant educational experience surrounding, but not limited to, primary care, preventive medicine, lifestyle medicine, non-surgical weight management, and chronic diseases. So today, Dr. Faridah is going to share with us on behavioral changes, the missing link in management of chronic disease. Welcome, Dr. Faridah.
Thank you very much for the kind introduction. Good evening, everyone. And also thank you for the organizing committee for giving me the opportunity to share on this very, very important clinical practice on behavior change. Hopefully, I will highlight a few things. How can we actually manage chronic disease with lifestyle change? And then I'm going to point out where are the missing links in the management of chronic disease. Right, so first, my content are only two. Number one is just a little bit overview on the chronic diseases. And number two, about behavior change in the management of chronic diseases. Right, first of all, what are the chronic diseases? So chronic diseases is actually defined by CDC broadly as a condition that lasts 1 year or more. Okay, now we can see that there are many definitions of chronic disease, but this one is actually giving us the length of time. Okay, and require what? Ongoing medical attention or limit activities of daily living or both. Right? So what are the most common in Malaysia? The usuals all over the world, not only in Malaysia. The coronary heart disease, diabetes, stroke, cancer, CKD, respiratory disease. This is not new, right? So the recent statistics on causes of death in Malaysia published last year, but collected 2022, same thing again. We have the ischemic heart disease first, pneumonia second, cerebrovascular diseases, stroke third, and of course COVID is there, and then of course the accident is there, cancer, chronic lower respiratory diseases, hypertension, diabetes, malignant neoplasm of breast. This has been going on for quite some time in Malaysia, right? So this is the most recent published, the National Health and Mobility Survey of Malaysia, whereby over 500,000 or 2.5% of adults in Malaysia actually living with 4 non-communicable diseases. So what is new there? Obesity has been added as one of the NCDs, right? And then the diabetes, hypertension, cholesterol, and obesity. What are the significance of this? These are actually the major risk factors for heart disease and stroke, right? So almost 2.5 million adults in Malaysia living with 3 NCDs. The top 3 combinations are of course, the diabetes, hypertension, and high cholesterol. Again, this is not new, right? So what are the common facts about them? Common fact number 1, they tend to be long duration. We do find patients sometimes coming to us, doctor, can you cure this? Yeah, if I start medication, can you take it off after some time? Very common from patients, right? But what are another common fact about this is they are usually the results of combination of genetic, physiological, environmental, and also behavioral factors. So when we are dealing with management of chronic diseases, basically we are managing behavior. Even though we are prescribing them, even though they would need medication, again, we have to make sure that they are taking them. Again, managing behavior, right? So these are from WHO. So next, is about role of behavior change in the management of chronic diseases. Where do we put this behavior change intervention? Okay, so this is from WHO. WHO says the risk factors of NCDs, there are 3 groups. Number 1 is who you are. So your genetic, your age, your gender. Number 2 is what you do. So basically your behavioral risk factors. So the most common things, again, the tobacco use, the physical inactivity, harmful use of alcohol, unhealthy diets, yeah? But there are also the 3rd group of risk factors, which are the things that we develop over years. The blood pressure, the obesity, the diabetes, the cholesterol, right? So this is what has been outlined. But how about in lifestyle medicine? So we like to go more complicated on this. So defining real causality in lifestyle medicine is this. So there is a hierarchy of chronic causes of chronic diseases. So when you have the diseases, these are the common diseases that we have. All over the world has that also. There are the risk factors. These are mainly the metabolic risk factors, the things that we developed over time. So there are the cholesterol, the diabetes, the hypertension, right? But then, what is actually making people developing these risk factors? So there are the proximal causes. So these are the lifestyle, the things that we do. So there are the smoking, diet, inactivity, the body fat, yeah? But what makes us actually doing that? So this is when we have the medial causes. So in the medial causes, we have the psychological component. So a lot of things that we decide in life, especially our behavior, is actually controlled by our psychological being, right? So that will be the stress, the anxiety, the depression, the social or peer pressure, yeah? It's not my fault, my friend asked me to do it, all right? So very common, yeah? And then, of course, technology change, yeah? We do have things that we don't have to move anymore. Yeah, we can open our gate on the way we are driving, we can open our gate already. Yeah, we can switch on the lights, switch on the fan, switch on the aircon. We can do that while we are actually traveling home, right? So now, what is causing that? Again, what we call the distal causes. These are the environment. So these are the modern lifestyle, the industrialization, the economic growth. So all these are actually, in the end, are the risk factors causing the diseases. So in lifestyle medicine, we are tackling the disease not only at the end here, but towards the roots of the cause of the diseases. Right? So that is a basic concept. Now, so what is lifestyle medicine? The application of environmental, behavioral, medical, and motivational principles to the management of lifestyle-related problems in a clinical setting. Right, so how do we practice then? As a practitioner, so how can we actually practice the complicated link just now? So there are 3 core principles in the practice of lifestyle medicine. Number 1 is about we need to understand what does it mean by the socio-economic determinants of health. Health has many determinants. So one of them is actually the socio-economic determinants. And then we would also need to learn the behavioral skills because we want to change the behavior of people, right? So, and then, of course, what are we trying to change there? So we, as the provider, we need to actually strengthen our knowledge on the pillars of lifestyle medicine. Okay, so these are the 3 things that I would like to cover. Okay, first of all, the knowledge of the 6 pillars of lifestyle medicine. So these are the 6 pillars of lifestyle medicine. You have 1 is about healthful eating. So basically, for healthful eating, is about increasing plant-based, whole plant-based food. But it doesn't necessarily that the patient has to go into becoming a vegetarian. No, it's just that to increase, to make sure that they are taking in enough fruits and vegetables. All right? So number 2 is the physical activity. What does it mean? Physical activity will have increase your physical activity in your activity of daily living, like more walking, yeah, instead of the lift, and also structured exercise. So usually the structured exercise, general recommendation is what? The 150 minutes per week. So generally it's just that, all right? So number 3 is about avoid risky substance, like the alcohol, the smoking. Number 4 and number 5, number 4 is improve your sleep, because lack of sleep is actually associated with increased risk of developing the chronic diseases. right? Then number 5, and hold on. How do you go back? Here. All right. So number 5 is about form and maintain relationship. And then number 6 is to develop strategies to manage stress. Because stress is unavoidable. It is there every day in our life. So we need to be able to manage the stress. All right, so just a little bit of statistic. Point number one, healthful eating. Eat enough food and fruits and plant, right? So our statistic says what? Dr. Siva has said this earlier. Only 95% of adults in Malaysia actually consume inadequate amount of fruits and vegetables. The usual recommendation, two portions of fruits, 3 portions of vegetables. We cannot even reach that, right? So then, next, about the being active. The NHMS stated that 1 in 3 adults in Malaysia is not physically active. Okay, 1/3, 30% not physically active. And out of this 30%, 84% of adults are not active in sports, fitness, or leisure activities. Okay, and 84% do not walk or cycle from one place to another. Always on something, always using something, all right? So 1 in 2 adults in Malaysia led a sedentary lifestyles. So just imagine the things that we have to change there. So it is a challenge for us, right? So next is about the using of substance. For tobacco smoking, even though the percentage is coming down, maybe using alternative, maybe, yeah, we don't know that. But then the percentage of people, Malaysian, who are smoking is still high. Okay, and a lot of them is actually in the pre-contemplation phase. Okay, the use of alcohol, 1/10 of a Malaysian actually drinking alcohol, right? But out of them 1/10, 50% of those who are actually drinking, they are drinking excessively. Okay, so that will be another challenge for us. So number 4, improve sleep. How are we doing in this sense? So actually, 2 in 5 or 38% of adults in Malaysia are not getting enough sleep. So that is again a significant number, and more in the urban areas, yeah? And then insufficient sleep by age group, you can see here, most of them are actually in the working age group. Okay. In terms of mental health, so there's still a significant percentage of people in Malaysia are having actually fulfill criteria of having depression. Okay, so this is a study. This is a cross-sectional study to assess the knowledge and practice of lifestyle medicine among physicians. Are we doing enough? What is our knowledge and what is our practice? Okay, so this was done actually among doctors in the medicine field, surgery, gynae, ER, pediatric. Yeah, not actually the primary care doctors. Okay, so and then nationality, Saudi, Pakistan, Egyptian, Indian, Canadian, so it's a combination there. Okay, and actually 11% of those participants are actually smokers themselves. Okay, so when they were asked about their practice, they were asked first about what do they think about the impact of lifestyle modification on NCDs, on chronic diseases, yeah? So 85% said, oh, there is a very high impact, more than 60%. But 15% said there's no impact. Okay, so that is a significant number. And again, about exercise, 90% advised about exercise. But did they actually advise correctly? Only 1% advised to do exercise 5 days or 150 minutes a week, which is the requirement. Only 1% out of the 90% who are actually advising. So next, asking about smoking. A lot of people, doctors, practitioners are actually asking the male only. Yeah, some may be asking the female. When it's come to alcohol, they only ask the male, but not the female. Okay, so that is in terms of practice. Now, when we ask them, what is their opinion? What are the components of lifestyle medicine? So actually, diet and exercise, most of them will say yes, that will be components in the lifestyle medicine. However, when it comes to like stress management, about smoking, obesity, they were not so sure. Even obesity, only almost half of them said it is not actually included in the lifestyle medicine element.